guys. It's Dr. Deborah Durst with Revitalyze MD. I am a traditionally trained MD that has a specialty in emergency medicine and practiced that for 25 years. I began my journey into anti-aging aesthetics and wellness 10 years ago, and since then I have been passionate about helping people comprehensively look, feel, and function better. I do have a guest here with me today, Samantha.
Hi everyone, my name is Samantha Addis. I am the office manager at Revitalyze MD, so I work extremely closely with Dr. Durst on a daily basis with our patients, and my main job is to make sure that our patients have top-notch quality care. So, Dr. Durst, if you want to tell us what we are going to be talking about today.
So we're going to talk about an aesthetic consultation and what that means and what that should look like.
So when our patients call explaining that they want to get Botox, they want lip filler, maybe cheek filler, or PDO lifting threads, we go ahead and schedule them for an aesthetic consultation with you. Will you just explain a little bit about what goes on during that consultation?
Certainly. So when we do the consultations, we try to make that an appointment with some time so that we can more comprehensively evaluate somebody. And I think that's how our office is or really wants to be different with every patient. So even though a patient may think they want Botox or they want threads, when in actuality, depending on the age, they might need a little bit more. And so what I like to do is sit down with them. And again, I review their medical history thoroughly. So I know what medicines they're on, I know what surgeries they've had, whether they're on blood thinners, whether they've had previous procedures or services done. And then I also want to know what their goals are, what they're looking to improve. And so then I go through all of that, because if you're young, like yourself, you might just want to come in and you might have a specific thing such as pigment. And maybe we're doing a simple, IPL laser treatment that lifts pigment. Or maybe somebody wants Botox, and then it's more simple and straightforward if somebody's young, but they still need to be educated. Yeah. And so I like to look at it more comprehensively for what are they looking to accomplish? How can we get them there? And that might take different treatments or services.
Yeah, because we do so much, so they might not even know fully what all we do, because it's pretty extensive. So I think coming in and having you educate them what all the different options are, because they might only know IPL and that's all they've ever heard about, so they think that's the only route that they can go. But when you explain to them that, hey, if you mix it, combine it with other things, it does help more. Yeah.
No, that's exactly it. And I think, again, if you're going to specifically more of a med spa type setting, you might be coming in and requesting a specific treatment, and maybe they don't have the medical experience or knowledge to provide you with more comprehensive services, and that may not be the case. But I think that with all of our medical experience in the office, and definitely we want to approach it in a more comprehensive, natural way, sometimes more regenerative way, but you may not even know those services are there. So our job is to educate on what we can provide to get them the goals that they want to achieve. And so, again, it may be more simple on a young person, but again, if pigment's an issue and say we choose to do IPL, we need to talk about skincare products that are going to help with that too. Sometimes people will have dry or oily skin, and a lot of times that's really a function of skincare products. And so adding that in, making sure people know about sunscreens. But really, I kind of go through a kind of firm fill finish mentality. So if I think somebody needs firming, which means lifting, I'll talk to them about the different options with lifting that we have and what might best accomplish the goals they're looking to receive or to meet. And then I might also talk to them about volume loss, if maybe it's cheeks that they want, or nasolabial folds is a huge thing because we don't really need to address it as a volume loss there. We can address cheeks. So I kind of then go into, do we need volume loss? And maybe there's some things we can do first to minimize what we need in the way of fillers. And then again, finishing or resurfacing, I don't think people talk enough about. Yeah. And so we definitely focus in, and the office staff is awesome about that, and just educating people about what resurfacing means, which is...
I think you being the physician, you're always there, you know, whether an esthetician's doing your treatment, they're always going through you to get approval to do that treatment if it's really the best fit. You know, our esthetician, Marissa, she's always coming back to Dr. Durst's office, finding out if, you know, this is actually what she should be doing. So I think them knowing that they have that physician on site is comforting for them, because you always are the most educated and the most professional about their skincare. You know, it's extremely important to you. So I think that's something that's comforting.
Well, and I think that we do. I mean, again, the office is like, it's a team approach, and you guys are all educated on all of the services and do a wonderful job. So if it's from the beginning, from the front to the back, like if they're talking about skincare, you guys are great about that, talking about the services. But likewise, you know, Marissa, the esthetician, you know, if she's doing it again, we're kind of talking and discussing as a team throughout the office on what we think is best for the patient. And so even though I meet with them and go through, again, more of like a firming, how do we firm
their
if we have
entire
volume
aesthetic
loss,
plan,
their aesthetic plan, then we're working as a team to accomplish that. And then they can go out also and have a plan, right? And then they may choose one part of the plan, but at least they know all the steps that might be needed to get them that final result. And so that's where the team also knows. And we've discussed it, you know, after that initial consultation, or sometimes I'll pull you guys into that consultation when we need to. And we can do services those days frequently. But I like to educate them overall, like if this is what you're looking to accomplish, this is probably what you're going to need, and maybe multiple things or multiple steps. And then they can decide where they want to start, but they have an overall plan. And then again, you guys are awesome about educating and you know, again, being with them on that journey to accomplishing those goals.
Yeah, and I think it's always best to come in for that consult to really see what is needed for you. It's not something that you can figure out over text. It's definitely something you like to visualize with them, show them pictures. You know, it's definitely something they need to come in and be evaluated and then given an explanation on what exactly those treatments are, because there's a lot of different treatments, and someone on the outside, like before I was involved in this industry, I wouldn't know what they all were. So it's definitely overwhelming, but I think meeting with you really gives them a sense of like calm, because they're finally understanding and getting a professional approach to it all.
Yeah, and I think that it's meeting us at the office too. Again, I'm going to kind of oversee, and I think that overall consultation needs to be in conjunction, you know, with me for an overall plan. But you guys are awesome about the inputs. You guys are doing those services along the way, great at educating. And again, you know, I always said this in the ER, once you reach the doctor's office and the team, you need to probably put down the Google and, you know, get the information, because it's a rabbit hole. Otherwise, you're on Google, you're looking for things, you think you might have the answer, but again, you want to kind of find out what the different options are and discuss them. And a lot of times we have almost all of those options available in some way, shape, or form from an aesthetic standpoint. So I think, you know, once you decide who you're going to go to, it's worth going in for the consultation for sure, not just price shopping over the phone. You know, how much
quality care is more important than the price shopping part of it.
Well, I think the big issue is, like, I don't know that I would go just to the place if I called and said, you know, I want cheeks, how much is a syringe of filler?
That's it. I don't know if I'd want anyone just putting filler in my cheeks. I think it's important to educate yourself on who is actually doing it.
And maybe meeting with them first, you know, and then deciding, you know, that cost, you know, issue does play a part. I'm not saying that, but I wouldn't base it just on that. You want to have somebody experienced doing it. And so, again, our staff is experienced. They're educated, and everybody's, you know, doing the services in the same way. And so you're going to get consistent and beautiful results. And you're going to look younger naturally. So what should they do, Samantha, since you're way better at that?
They should go ahead and give us a call or text us. We're responsive on everything. You can message us even on social media, which we'll link below all of our social medias. And then you can follow along on our YouTube videos and our podcasts. We'll just go over different options. We'll start diving into other aesthetic treatments that we have. and then Dr. Durst can.
Well, you can like and subscribe, share with friends, and then definitely in the comments, just put anything you might want to hear about, because we're going to dive deep on all things aesthetics, all things wellness, all things sexual wellness. We're not afraid to talk about anything. So if there's something you want to know, please let us know. And again, we're here to revitalize your look, your health, and your sex life. Thank you.
Bye-bye.